So good morning, everyone. It's 380 days since our first case back on March 12th. We're in week 56, believe it or not, and but things are going in the right direction. Kind of went up a little bit, back down. But as of today, we still remain with 366 people that passed away from COVID-19. Again, my prayers and thoughts go out to the family. And as of right now, there's 22,624 cases of COVID-19 to date in Albany County. We have an increase of 71 positive cases since yesterday. The day before that was 61, and the day before that was 60, so we kind of went up a little bit. The 5-day average is 65.4. Yesterday it was 66.2, so that went down, which is good. There are currently 1,395 people under mandatory quarantine. Yesterday it was 1,443. Of the new positive cases, 23 didn't have a clear close contact to a positive case. One is a healthcare worker, and 47 don't have a clear source of infection at this time. There's been 22,028 people who have tested positive for the virus and have recovered. That's good news. 67 recoveries since yesterday. Unfortunately, we had 3 new hospitalizations last night, so we currently have 24 people in the hospital, and the day before that was 23. Currently, there's 5 people in the ICU, and yesterday there was 5, and that number kind of went up a little bit in the last couple days. Our Albany County 7-day average for percent positive rate is now 2.2%, down from 2.5 March 31st, which is good, and went down a little bit. Not much. We'd like it to continue to go down, be under 2. The Capital Region 7-day average is 2.3. We're likely to see these numbers go up after the holiday. We hope everyone listened to Dr. Whalen and myself when we said, please socially distance, wear your mask, cough into your arm, clean your hands, stay 6 feet apart. We know if both of you are fully vaccinated, you could be there under the CDC guidelines not to wear a mask. Only if everyone in the household has their second shot and is through the whole period of that they have the antibodies built up. So please, hopefully everyone did the right thing. I know a lot of people went out to church for Easter, so all the news articles last night, everyone seemed to have the mask on. I think 56 weeks. I think we have it down pat, how to, socially distancing and doing it without infecting anyone around us, so which is also good. We do need to continue to get the vaccine out there. Dr. Whalen has a great commercial out there with a variety of Dr. Bennett and Dr. McKenna and a variety of other people that are out there. Don't hesitate, vaccinate. Please. I know that numbers dropped, which is good. In the beginning, the hesitation we had to people taking the vaccine. We're not seeing that as much anymore, which is great. From our PSA commercials to the don't hesitate, vaccinate, to everyone out there in the community telling people to get it. It's all good stuff. So just want to remind you, if you need to wait 2 weeks after your second shot or the second week after your first shot of the Johnson & Johnson, as Dr. Whalen said, and she can say it better than me when she talks, it's 21 days between your first and second shot. Of Pfizer and Moderna's 28 days, and Johnson & Johnson's 10 days. Just keep track of that. Just because you get the shot doesn't mean you're vaccinated and you can go out in public and not wear a mask and do all that other stuff. If you want to see if you're eligible, please go to our 1-833-697-4829 and check to see if there's appointments. There are more and more appointments popping up because now we all know the eligibility change, 16 and up, which is great. So there's no more waiting. There's no more, hopefully there's no more Hunger Games that you have to continue to try to fight to get a slot to get vaccinated. We have the standby list here in the county. We have the pre-registration, which takes a lot of the anxiety out of it. So please continue to use that. Use the 211 number. Call there if you have any questions. I was walking around the neighborhood yesterday and talked to a gentleman, and there's still people fighting to get spots online, and that honestly breaks my heart. Because at this point in time, we should have this down pat. It should be easier for people, and that fighting to get a vaccine for their loved one or for themselves shouldn't be going on right now. Some of the good news, over 40% now have the first vaccine in Albany County. That means we're a little under 30% before we get to that 70%, which we need to be at. 26.4 have completed the vaccine altogether, which is good news. So we are moving in the right direction. Compare that to the statewide rate. For first doses, it's 33%, and for a full vaccination, it's 20.4. So everything we're doing here, we're getting it out. People are getting the shots, and I'm hoping that by the summer we get some type of normalcy. Also hoping that by the summer Dr. Whalen's team and everyone else gets somewhat of a break, from have to doing mass vaccine clinics throughout the whole summer into the fall. But again, the more vaccine that gets available, the more we get it out. And again, please sign up. Starting tomorrow, again, those over 16 can register. So please, anyone out there who wants to get it, I encourage you to register. I encourage you to use our pre-registration. It is being used by 3 counties in the Capital District because, again, we're all in this together. I have got a ton of questions on schools with the 3 feet apart. I want to clarify this. It has not been from the State Department, DOH, has not given approval for schools to go to 3 feet. It's a CDC guidance which came out, I don't even know, Dr. weeks ago, maybe weeks ago, which we should be following, but I just talked to General Murphy just before I came down here, and they have still not gotten guidance from DOH for whatever reason. They're dragging their feet. I know there's a lot of schools that are still out, want to get back in the classroom. The 3 feet makes sense. It makes it easier for them to accommodate and not spend all that money trying to stay 6 feet apart. But again, as soon as we get the guidance, we'll let the school superintendents know. But as of right now, the state has not signed off on it for whatever reason. Again, please, parents, just be patient. School districts, be patient, and remember, those who are 16 and 17 years old eligible to receive the Pfizer vaccine. When signing up for your appointment, please double check that you're getting the right dose. And you also need your parents or guardians' approval to get the shot. So you can't just come in as a 16 or 17-year-old and expect to get the vaccine if you don't have that signed. So please pay attention to that, because the last thing we want to do is turn you away if you show up by yourself and you don't have the proper documentation. Please go to albanycounty.com. Pre-register, see what's available out there. If you don't want to go through our TU, you don't want to go through Washington Armory or UAlbany, there's sites out there. We'll continue to have pop-up pods as we move forward. And again, thank you to everyone that's doing the right thing. We're getting there. It has been a long 56 weeks, trust me. My staff alone and everyone out here that continues to be essential workers, continue to move us in the right direction. And to the people of the Capital Region that continue to do the right thing, thank you, thank you, thank you. Dr. Whalen.
Good morning. So, as the county executive indicated, we continue to work very hard to get doses of vaccine out to the community. I'm happy to say that this week we have a pretty large allocation that we're going to be working with, which includes 2,600 Moderna doses and 1,000 Janssen doses. In addition to that, we have received a supplemental allocation of 1,600 doses, which is earmarked just for college students. This is a new development. As we know, starting tomorrow, we can vaccinate those over 16. We have many times at these press conferences spoken about the concern of college-age students. So to be able to vaccinate this age group is going to be a great development. It looks like we are going to continue to get that allocation for the coming days and weeks, and we look forward to partnering with our partners at SUNY and Siena and the other local colleges to get vaccine out to that population. It's going to be a very important initiative to do that. Unfortunately, this week we did not get any Pfizer, so for those looking to vaccinate the 16 to 18 population, we will not be able to do that at our pods this week. But we look to next week's allocation. I know other partners in the county do have supply of Pfizer, so it's important for parents and those from 16 to 18 that are looking to get the vaccine to check when you sign up that Pfizer is the preparation that you're signing up for. Again, Pfizer is the only vaccine at this point that has been given the EUA for the 16, 17-year-old population. If you are 18 and above, you can receive Moderna, you can receive Johnson & Johnson. So we look forward to getting those shipments in, and we'll be planning today and announcing dates for those pods probably tomorrow. We continue to get shipments weekly, and so the planning, although we are getting into our groove during this week 17 of vaccines, we still have to plan for those pods on a weekly basis. So we give you the information here. Usually it is on Monday mornings. We find out usually Saturday or Sunday what we're going to get for the week, and then our team meets on Monday to plan how we will either reallocate to our partners and hold pods for residents of our area. So we continue to look forward to this. Our numbers are holding steady. Our numbers are holding steady, and that's not a good thing, and it's not a bad thing. We need our numbers to start to decrease. And, you know, it is my hope that we don't see the post-holiday bump that we have seen previously with other major holidays, but we'll be monitoring very closely in the coming days and weeks and continuing to follow along. But in the interim, it is essential that people continue to do the behaviors we've been discussing. Masks are still necessary. Hand washing, staying at home when you're sick, testing when you're feeling unwell. Again, spring is a time that a lot of people have respiratory complaints. Sometimes they're due to allergies. Sometimes they're due to something else. If you have something that feels like an upper respiratory infection, that even if it's mild, it is still necessary for you to be tested so that you can isolate appropriately and prevent those you love from getting COVID if it is COVID that you in fact have. So testing is still an essential strategy. Community mitigation, such as wearing masks, avoiding large gatherings, and hand washing are still essential. And sign up for vaccination. We look forward to seeing you soon at our pods.
Dr. Whalen, thank you, as always, and I can't believe it's been 17 weeks. I'm like, where did 17 weeks go by that we've been vaccinating? To everyone out there helping, from not, just our Department of Health and Mohawk Ambulance, Sheriff's Department, everyone that's involved. Every time we get a shot in someone's arm, again, we get closer to getting back to some type of normalcy. So, again, I want to thank the sheriff and everyone out there doing this, and all the clinics and the little pharmacies that are out there, and Walgreens and CVS. We're not a little pharmacy, but that are out there doing their job. So thank you to everyone. But, as we talked about the fallout of COVID-19, the health crisis, the economy crisis, people really were struggling these last 56 weeks. People, and I want to say this, the people that are out there that didn't have to struggle about putting food on the table or deciding, do I pay my heat? Do I keep the cable on for the kids? Do I keep internet on? God bless you, and thank goodness you don't have to make them decisions. But unfortunately, a lot of people did get laid off. A lot of this has a huge impact on a lot of neighborhoods with underlying issues that always had issues with food and other things. And one thing I love about Albany County, being county executive and here in the capital region, is that when we get knocked down, we either, we get up, we dust ourselves off, and we continue to move forward, and we get tougher, and we come up with solutions to the problems. When I kept saying, be part of the solution to the problem, don't be part of the problem, stop with the negativity. You can make a difference in someone's life. It doesn't matter who you are. You don't have to be a politician. You don't have to be whoever you think you need to be to make a change. You can do it. You can make a change, and it's just like every vote counts. In this case, Jamal Anderson, who made a huge difference in this area with the fridge idea, going around to neighbors, not just here in Albany, in Troy, Schenectady, putting these refrigerators out, putting food in there for people that just stop by to get. What a great idea, first and foremost, to think about it. I don't know how you came up with the concept, but when you look at Time Magazine and that she made the cover is awesome. That they highlighted you, not just for the extraordinary work that you've done, but the difference you made in the community, showing that even in difficult times, you can make a difference. And honestly, the free food fridge in Albany that we've seen, how did you even come up with the idea? I was actually kind of curious.
Well, thank you for having me. The idea wasn't necessarily my idea, but it was sort of a reconfiguration of an idea that's been going around all across the country in bigger cities. So I figure, Albany is such a special place, and the way that things work around here is very different. And there is like a few different ecosystems that all work under, in the same ocean, if you will. And so I decided, what can I do to help the community to have more access to better food? And so this idea changed a little differently. So in other places, you give food, you take food, whereas this idea is that restaurants, farmers, and individuals who are able to spread their wealth and redistribute their wealth, whether it be $1, $10, $5, whatever it is, and just put food in it. So then community members who may not have ever experienced a food apartheid or food insecurity are able to just take with complete anonymity. And I think that it takes a lot of layers of shame out of it, and is a better way to show that the community is here to support when we don't think they are all the time. And then those who are affected, the income cliff, which is a term I've heard recently. The income cliff for people has been really dramatic, especially with multiple parent households and having a lot of kids, or whatever it may be. So people are not able to go to work because they have to stay home now, and so they're not making enough, or they make just too much. And so before it was, it felt like a specific group of people was going without, but now it's running rampant through all communities. And so it was a really beautiful way to encourage the community to come together, to supply and support, and to continue to do that, and really have a wake-up call of hey, we all really need to come together. And people who are houseless, people who are in marginalized communities, we're all each other's neighbors, and if we can all work together, then we're gonna get through this a lot easier. And I'm not here to take over anything. I just wanna amplify the already really wonderful programs that are going on.
I'm glad that you have. So, very modest in the fact that they only devoted 2 issues to these topics, and to be picked on a national level is phenomenal, and to have you here. So one of the reasons we do have you here is to recognize you as Albany County Executive Citizen of the Month. And I do want to say, we started this last August, and we talked about all this stuff, but what you have been doing over the course of this quietly to really, unfortunately there's kids out there, people that, go hungry at night, or don't have proper food to eat, and what you have done to change that, to lift up spirits, and you'll probably never be thanked for all the people that you helped out, and not fully know the impact that you've had on a community. But I'll say this, and I challenge the rest of the citizens, you can make a difference, you can do stuff. People that have extra money, please donate to something like this to make a difference. Buy food from a restaurant, give them the gift cards, and they can get them out to people that might enjoy a nice Italian meal someplace, or a steak someplace that doesn't have the opportunity, and to make the difference. So I do want to say we do have a proclamation for you. We're going to give you.
Thank you.
And proclamation for Albany County Citizen of the Month. So we have that for you.
Thank you so much.
We have our coin, our county coin,
Oh.
and our pin. So it's pretty neat.
Thank you.
Yep. And then you can use this for target practice later. I know somebody in the audience would help you. But, you know, it's, you know, just to put on your wall and to say really thank you. Thank you for inspiring the next generation, and to the people out there that don't think you can make a difference. You don't have to be in office. You don't have to be wherever you think. Look at your story. It's awesome. And I have to say, you make me proud to sit here and to recognize you.
Thank you so much.
I'm going to keep your magazine. Is that all right?
You can keep it.
I'm kidding.
You can. I got a lot of copies.
Oh, did you? All right, I'm going to keep it then. All right, because we were trying to find a copy. But again, please, everyone, make a difference. I'm glad that we can start honoring people. Hopefully we get back to honoring a veteran soon, too. But to the citizens here of Albany County, we appreciate everything you do, from the healthcare to everything else. And thank you so much.
Thank
and
you
see,
so
you weren't
much.
that shy. See, you're getting all nervous.
I'm always nervous.
That's all right. You got to be nervous, right? That's how
Yeah.
you get things done.
Yes.
But see that? You did an awesome job.
Thank you.
So, again, thank you for letting us honor you. I really do
thank
appreciate
you for having
it.
me. I appreciate it. It
And
feels good.
to all you kids out there that have been home for the year, you can do something like this. Make a difference. Get off the video games. I also want to encourage everyone to go to our website, albanycounty.com, to view all the different testing locations across the county, as you know, vaccine sites. So please go there. I also want to remind everyone, April is Sexual Assault Awareness Month. Tomorrow we encourage everyone to you know, rise awareness and wear teal and make a difference. Please, if there's somebody out there, speak up. Don't be afraid to. Don't be afraid to lose a friend because you said something to protect somebody. I know it's the hardest thing, but it's better to live in life knowing that you helped that person and they don't want to talk to you and you broke that cycle. So please don't be afraid to stand up for your friend. Because whether they appreciate it now or never appreciate it, you know that you saved their lives and you stopped that violence. So please, by all means, speak up. Our mental health support lines available still 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. Please, not just for adults, for children. We know what's going on out there. The world's different. Reimagine what's going out there and try to put yourself in someone else's shoes. And take a deep breath, because I've said it, it's you know, it's not a sprint, it's a marathon. We're getting there though. And I think I'm putting a bigger smile on, because it's like we're almost there, Dr. Whalen. We are almost there, right? But again, thank you to everyone doing the right stuff out there. Our 24-hour sexual assault hotline number is always 518-447-7716. Thank you to everyone doing the right thing. Hopefully our numbers don't go up and we continue to go in the right direction. Please be safe out there.